Morning, I'm Rachel McInerney. I'm a nurse practitioner in a Chatham County Health Department. We use a small EMR called Patagonia, and I'm discussing today about health information exchange and how we can make this work to better improve the care of our patients. So health information exchanges are ways to share information about patients through a network, and this increases patient safety and increases healthcare efficiency, and it helps to avoid readmissions, it helps to avoid medication errors for our patients, it helps to improve diagnosis for our patients, and it helps to increase duplicate testing. One of the ways that we can ensure that this is a safe thing for patients and for different facilities is by implementing the federal law, HIPAA. So HIPAA is a Health Insurance Portability and Accountability Act that was put into place in 1996, and this is a law that has been put into place to ensure that patient health information, you have rights over that information no matter what form it's in. So the HIPAA privacy rule is definitely something that's going to be something in place for the federal government to ensure that everything is safe for transference of information from one facility to another. Something that needs to be built into an electronic medical record to ensure that HIPAA rules are in place and that the Privacy Act is being abided by is things like access control, so passwords and PINs to get into a patient chart. Another thing that needs to happen to ensure that HIPAA is being protected is to encrypt that stored information within an electronic medical record. So this means that the health information can't be read or understood unless you have a certain system that can decrypt it. Something else that needs to be put into place with electronic health records and the health information exchange is an audit trail feature in which you can see who went in and looked at your information, who made changes, when those people made changes, and things like that. So another thing that is put into place, federal law as far as health information exchange and the HIPAA Privacy Act, is that if there is a breach to that system, then the doctor or hospital in question will have to notify you of that breach. So another thing that is in place, so that breach has to be notified. You have to notify the Secretary of the Health and Human Services. If a breach affects more than 500 people, then the healthcare provider must inform prominent media outlets through that state and through that jurisdiction. Something else that is in place is the Office of the National Coordinator for Health Information Technology, and this helps to keep that HIPAA rule in place, and it's something that they work with is the nationwide privacy and security framework for electronic exchange of individual health information, and there's things in there in place that make sure that health information isn't obtained or looked at by other people. So within that framework there should be individual access. So the individual should be able to access his or her own private health information through a secure device and through a secure means. So this will help to keep everything protected for that individual. The health information exchange should be able to provide patients with a timely means to dispute any entries into their health information record, and this is the capability for the patient to work with their provider to make amendments to that system and to that record. The entities that participate in health information exchange should provide a clear notice of their practices and policies regarding how that information is disclosed and shared and how they can obtain that information. Health information exchanges should provide individuals or patients with a reasonable opportunity and capability to make informed decisions about the collection, use, and disclosure of their information. Individuals' identifiable health information should be collected and used only to disclose it to the extent necessary for a specified purpose. So you can't just share that information just because you want to. You can't just go into that patient chart just to look at it to see what's going on. Individuals should, their health information should be protected with reasonable administrative, technical, and physical safeguards to ensure that remains confidential and that the integrity is there and that there is no ability to for somebody to go in and look at that chart without authorization. In regards to North Carolina and the Health Information Exchange, Article 29A is called the North Carolina Health Information Exchange Act, and in having this in place, the General Assembly makes the following recommendations and findings. They want to ensure that the Medicaid program is that there's timely access to the Medicaid individuals chart so that we can assess the performance of that system and pinpoint medical expenses and trends and identify health risks and evaluate to see how the state is spending those Medicaid dollars. And they did this because they noticed that there was an escalating cost to the Medicaid program, and that is costly for not only the state but for the taxpayers and the Medicaid recipients. So the Health Information Exchange for the state of North Carolina will help to improve care coordination within the healthcare systems across the state. It will help to increase care quality. It will enable more effective population health management. It will help to reduce duplication of medication and medical services, and give us the ability to survey how we are taking care of our patients and increase the knowledge about the use of those dollars and facilitate more cost containment and cost effectiveness. Any hospital that has electronic health record should be connected to the Health Information Exchange Network so that they can look at patient demographics and clinical data based on Medicaid funds and look at those findings in a protected way. The North Carolina Health Information Exchange will give the Department of Health and Human Services real-time access to the data and information that is shared through the Health Information Network. And this also provides ways for us to ensure that those dollars are being spent in a cost-effective way. The General Assembly staff will help to ensure that the information disclosed to the Health Information Exchange Network is any information is de-identified, and this is just to protect that HIPAA privacy rule and to protect that patient's information. Any information that is disclosed through the Health Information Exchange Network will be the sole property of the state, so that is interesting. And any data that is derived from that information will remain under the property of the state as well. So that is interesting too. The North Carolina Health Information Exchange was created by the North Carolina General Assembly to oversee and administer the state designated health information that they receive, and people that are required to participate are hospitals, physicians assistants, nurse practitioners, anybody who provides Medicaid services. They need to make sure that their electronic medical record is in place by June 1st of 2018. Any other providers of Medicaid services will need to ensure that they are connected to the electronic medical records by June 1st of 2019. So some people have a little bit more time than others. In order for us to ensure that the Health Information Exchange works for us as a state, I would think that it would be nice for the entire state to use the same electronic medical record, as this would promote every chart to look the same, all the lab results would look the same. What I see here would be the exact same thing as somebody in Asheville would see. So the charts would be easy to read and that type of thing, easy to share. The EMR would also have set federal laws in place, all of the privacy acts in place, all of the state laws that would be implemented for the Health Information Exchange would be in place. The state would have to ensure that only one system was safe for use, which would be to the state's benefit, I would think. The other thing that would be nice is that if Medicaid funds were saved, using the health information exchange was implemented back into the system to better that system. So this is supposed to make it more cost effective for the state of North Carolina. If they took those funds that we are saving and put them back into the system to make that system a better system, the maintenance of those systems would be less costly. Those systems have to be updated continuously, and this can be expensive for small healthcare systems. So if that money was put back in, I would think that it would make it easier for people to get on board with the health information exchange. And that's about all I have to say about those things. Thank you.